So what exactly is a full mouth rehabilitation or reconstruction? Now, our teeth undergo function as we go through our daily lives. They go through wear and tear, and in some cases they develop decay, or we might end up losing them. Losing one or a few teeth is not so much of a problem these days because dental implants are able to replace them very predictably. The situation, however, becomes a lot more challenging when every single tooth in the mouth is involved. When that happens, this case becomes a full mouth reconstruction. Large reconstructions involving multiple teeth or implants are typically very difficult to carry out, and they may involve multiple specialties or specialists in the plan. In this situation, a prosthodontist is ideal because we are well trained in dealing with different specialties and coordinating the entire treatment to ensure that the patient gets the best outcome. Now, there are a few categories of patients who need full mouth reconstructions. The first category is patients who have lost all their teeth. It could be due to gum disease or decay or a combination of both. Either way, they are now left completely edentulous and are probably wearing complete dentures. Such patients can be managed with implant reconstructions involving 4 to 8 implants in each jaw. Once that is in place, we are now able to use the implants to support an entire arch of teeth. A second category of patients who may need reconstructions typically begin dental work at a very young age. They usually start by getting fillings, which eventually become root canals and potentially crowns. And over time, even these crowns begin to fail. When that happens, sometimes the right solution is to treat the entire mouth all at once by replacing every single tooth or by restoring every single tooth depending on their needs. A third category of patients who need reconstructions don't have decay to begin with. These patients may be grinding or bruxing their teeth and getting them quite worn down over the years. When that happens, we are now able to use dental ceramics to adhesively bond to the teeth, restore what is missing, and rejuvenate the smile back to where it used to be. There is also a small, special group of patients that may need dental reconstructions. They could have been born with congenital defects like dentinogenesis imperfecta or amelogenesis imperfecta. Other patients may have undergone resection of teeth or oral structures after cancer treatment. If you identify with any of the scenarios that I described above, please see a prosthodontist, get a consultation, and learn what your options are for reconstruction.